and get started. Hi everyone, good afternoon. Welcome to our October monthly session for our San Joaquin Stanislaus CPI. Great to see you all here today. Just a few reminders, per usual, we are recording this session and we'll make sure to send out the recording in our post-session materials. For our icebreaker question today, just wanted to ask folks what is something you're looking forward to this week. So feel free to put that in the chat. Maybe it's something fall related or just taking some time to rest or do something fun. Would love to hear that. And also welcome to put your name and organization in the chat as well. Also, just per usual, encourage folks to listen, engage, use the chat function as you have questions, or you're also welcome to unmute. We want these sessions to be as interactive as they are in person. And then also just wanted to give a brief welcome for anyone that might be joining us for the first time, and this is your first collaborative meeting. Our collaboratives are a space for us to be able to gather local, regional Medi-Cal transformation stakeholders from San Joaquin and Stanislaus on a monthly basis so we can come together to be able to collaborate with one another, identify challenges, and problem solve with the goal of improving CalAIM implementation and helping to drive utilization of services. So encourage you as you're joining on to ask questions and introduce yourself. So we do usually like to hold space if there are any folks that are new and joining for the first time to just do a brief introduction if you would like to. So I'll just pause here if anyone wants to unmute and say hello. Not sure if we have new folks or if you're feeling a little shy, but you're also welcome to put intros in the chat as well. And I see folks are putting that in and talking about enjoying the cooler weather. Looking forward to Christmas time. I know I was at the grocery store and I already saw all that decor and stuff ready, so I guess we're approaching that time. So here's today's agenda. So after welcome and level setting, we're going to move on to doing some cross-sector policy and regional updates. We're going to have quite a lot of information that we're going to be sharing with you all today. So definitely encourage you after the session to take some time to sit with the information. And if questions come up, please definitely reach out to us. So we'll be covering housing interventions and transitional rent. And then also spending some time talking about ECM and community supports data updates. We'll talk through the primary measures as well as share some highlights from the quarterly implementation data and talk about also the DXF. And then we'll also hold space for regional spotlights. So this is your opportunity to share with others if there are any announcements, resources, or events that you would like to share with the collaborative. And then we'll hold space for our MCPs to share updates. And then just close out with some next steps and share a bit more information around office hours that are happening this Thursday. For our objectives today, we'll be learning about the relationship between BHSA, housing interventions, and transitional rent. We'll provide an overview of current data monitoring efforts, including just spending some time talking about the ECM and community supports primary measures, as well as providing a high-level overview of the quarterly implementation data. And then we'll receive MCP updates as well as share regional highlights, announcements, and resources with one another. And with that, I'm going to pass it to Melissa to kind of lead us through our next section.
Thank you, Navneet. Next slide. Apologies, everyone. I'm a little sick, but I wanted to kind of go over some updates that we just received from DHCS over the last week or so. One of these is the newly released FAQs highlighting the relationship between BHSA housing interventions and community supports. In this instance, specifically between transitional rent and BHSA housing interventions. As we approach transitional rent launch officially in January 1 of 2026, we are getting a lot more information coming from the state. And I wanted to kind of give you a high-level overview of this released FAQ, but also encourage everyone to kind of look at it and review it a little more thoroughly. One of the things to note is that there is an overlap between transitional rent and BHSA housing interventions. Both of these intervention types cover rent, storage, amenity fees, and landlord paid utilities. Whereas transitional rent, as we all know, is really focused on short-term rent up to 6 months, and the demonstration ends in 2029. While housing interventions through BHSA can provide longer-term support and complementary services. These FAQs really distinguish how both programs align to support individuals, but also demonstrate some key distinctions. One key point to really understand is the welfare and institution codes. So these do create limitations for BHSA housing interventions, noting that they can't fund services already covered by a Medi-Cal managed care plan. BHSA counties may not use BHSA funds for housing related community supports available through Medi-Cal, but they can fund complementary or additional services not covered by Medi-Cal. In the next slide, I'll kind of talk through a little bit of the preliminary authorization that can happen. Next slide, please. So in this slide, you'll see the streamlined provisional authorizations for BHSA housing. So if you are part of BHSA housing and are also a transitional rent provider, there are some ways that the county behavioral health agencies can conduct streamlined provisional authorizations. So these conditions must be met. This includes the county BHA agency being contracted with Medi-Cal members, MCPs as a transitional rent provider. This also includes the County Behavioral Health Agency determining that the member is BHSA eligible and commits to providing the Medi-Cal member with BHSA housing interventions at the expiration of transitional rent. And the County Behavioral Health Agency commits to sending a referral and request for authorization to the Medi-Cal member's MCP in a timely manner, at minimum within 14 days. And then consistent with APL 21011, the MCP must authorize or deny coverage of transitional rent. In most cases, Medi-Cal members will be eligible for both benefits, but this is where the provisional authorizations come through. So you'll see in figure 2 here that a county needs to determine BHSA eligibility and preliminary authorize transitional rent at the onset of a member needing this support. The county will send the referral and request for authorization to the member's MCP. And at this point, the MCP can either approve the request or deny the request. If the MCP approves the request, the MCP will cover months 1 through 6 of transitional rent. And then thereafter, the county can use the funds via BHSA housing interventions to fund months 7 and onward. If the MCP denies the request, this means that the individual does not get transitional rent, but is still eligible for county funding the BHSA housing interventions. In the next slide, I'll demonstrate some of the braiding that can happen to utilize these both funding sources. So if we can go to the next slide. In this slide, you'll see that there is a way for BHSA eligible Medi-Cal members who are receiving transitional rent from their MCP to receive simultaneous BHSA housing interventions. So in this instance, we are braiding BHSA housing interventions and transitional rent. This includes sequencing the housing supports for Medi-Cal members. So if you look at the image here, you'll see that months 1 through 6, you can use the housing related Medi-Cal community supports, including transitional rent up to 6 months. This typically will cover interim housing, rental subsidy, storage fees, amenity fees, and/or landlord paid utilities. And in addition to that, the individual can still utilize the housing transition navigation services, deposits, or tenancy sustaining services. If you are interested in also using the BHSA housing interventions, these ones below the housing related Medi-Cal community supports are the ones that can be used simultaneously. Starting on month 7, the individual, if eligible for both, can then transition into BHSA housing interventions. And this is where their housing assistance for month 7 and beyond kicks in. You'll see that it's very similar to what is in the transitional rent bucket, including interim housing or rental subsidy and storage fees, etc., as well as those other housing services not covered under the MCP. Through this route, the individual can also continue to receive housing-related community supports. Again, I know this is a lot of information, but I want to encourage everyone to review the FAQs and really understand how they can braid some of these housing interventions and transitional rent, especially as we approach the full launch of transitional rent. I'm going to go ahead and go to the next slide, please. Any questions that you guys have about the BHSA housing interventions and transitional rent? And I'll try to answer what I can, and anything that we can't answer, we will be fielding to answer. So I'll pause here and see if there's anything or any comments. Carrie, go ahead.
Okay, I apologize because I did get pulled away at the very beginning. So if I'm asking a question you already answered, I'm so sorry. But I'm curious if there is a workflow for this in terms of how transitional rent will be working in Stanislaus County, because it's not the same contract with BHCS through the county behavioral health that it is in San Joaquin. So my understanding is that it's being handled differently in Stanislaus versus San Joaquin. And so I just am wondering if there's some clarity there.
I see Eliana's hand up, and I might phone a friend because I think this is very specific to the county. The guidance that was the FAQs that came out are very like statewide specific, not regionally.
Yeah,
And each
yeah.
county is managing that differently. But Eliana, I know you came off mute, so I want to see if there's anything you want to answer
Yeah.
or amend or add.
Yeah, no, I think great coverage. I think of what the APL and some of the requirements. And I think what Carrie's asking is completely, where I think where we need to focus on in regards to like the specifics around the workflows for each county. The nuances around that is that each MCP may be contracted with different providers, right? So it may look a little bit different. So for example, in San Joaquin County, at least the goal for HealthNet is to contract directly with the behavioral health department. They will be the housing deposit provider, the housing transition provider. They will be informing us if that member is eligible for any sort of BHSA housing. Do they have a voucher in place? So there's going to be a few requirements there that we're going to be looking for, but the county is going to be doing most of that work, as well as being a flexible provider. So there will be a set workflow that HealthNet will publish according to the workflow in San Joaquin County. For Stanislaus County, it's going to be the same in the sense that we'll publish a workflow that will apply just for Stanislaus County, because the county is not the TR or the transitional rent provider, and they're not the flexible operator. We're leaning that work to our contracted local CBOs to do that navigation and everything else that was mentioned, right? And so to answer your question, Carrie, we will publish workflows. We're still kind of deciphering what does it look like, and I know we're close to go live, but hopefully we'll have something in place. The other challenge for Stanislaus County is that we don't have any contracts in place yet. We're still working with some of our providers on ensuring that they're able to stand up the programs. And so once we have that in place, we'll be able to develop workflows that call in those providers and kind of walk through the whole process for each county, which is going to be very, very different. The only other thing I wanted to mention before I pass it on to my MCP partners is that for transitional rent, although there is that 6-month potential eligibility, if a member has received any other sort of housing, like either short-term post-hospitalization, recuperative care housing, that may impact how long they are eligible for to receive transitional rent. It could be that it's 5 months, it could be that it's 1 month. And so when that comes to the managed care plans, HealthNet will have a referral form that's we're gonna ask our providers to complete and fill out, so then we can take that back, walk it through previous authorizations from HealthNet, and then determine how long the member is eligible for transitional rent. So there's a lot of administrative pieces that go on once we do receive that referral, and it may require additional information from the provider. But really at the forefront of what we need is that verification from behavioral health saying this person is in fact eligible for county mental health services. And so I think that's like where it starts, and then everything down trickles to the actual approval of the authorization. But again, more resources will be coming from the HealthNet perspective within the next few weeks.
Thank you so much, Eliana. And yes, to note, the FAQs do say, you know, a lot of this is MCP dependent, and so definitely encourage you guys to look at that. I want to see if there's any other questions, and if you do have anything, we can go ahead and field those in the chat. We're going to go ahead and move forward to the next slide, which is also transitional rent related. Okay, so some of you may have already seen this, but there is some transitional payment methodology components that were just released by DHCS. These were included in recent updates, and I wanted to quickly cover these as well. So component one, so there are two components for payment methodologies in this document. The component one is for cost of rent or temporary housing. So this notes that DHCS will reimburse MCPs the actual cost of rent or temporary housing paid to landlords or property owners, which may include the cost of storage fees, amenity fees, and landlord paid utilities that are charged as part of the rent payment up to the applicable reimbursable ceilings. So the reimbursable ceilings are really focused on the a percentage tied to the U.S. Housing and Urban Development Small Area Fair Market rents. And DHCS does expect that these actual rent or temporary housing costs will vary from case to case. And so we can't say that they're all going to be exactly the same. But if you go into the document linked here, you will see in table 1 that the reimbursable ceilings for rent or temporary housing are set there. And then the component 2 is the administrative fees. So these are leaning more towards the MCPs. So DHCS will pay MCPs administrative fees to cover the reasonable costs associated with delivering the transitional rent service. Fee amounts will cover the administrative cost of the MCP and the transitional rent provider. DHCS is, however, not specifying a fixed targeted amount or percentage of this fee that MCPs should allocate to the transitional rent provider. They recognize that the respective allocation of activities between the MCP and provider will vary by MCP and provider. So again, this may change. The only stipulation is that there are specific administrative fees by region. So again, that's demonstrated in table 2 and encourage everyone to look at that. We'll go to the next slide because this isn't the only time you're going to get this information. So there is an upcoming webinar that's going to be hosted by DHCS. This webinar is intended for all MCP staff, community supports providers, county agencies, etc. It will be hosted on Friday, October 31st, and advanced registration is required in order to get into that webinar. But yeah, I wanted to kind of quickly share about those two components. And of course, the document is a lot longer, so recommend you guys review that. But I will take us to the next slide and again pause to see if there's any additional comments from the MCPs or questions that you guys want to put in the chat, and we can share those with DHCS as well. Okay, I'll go ahead and move forward. Nevni, I think I'm handing it over to you.
Awesome. Thanks, Melissa. Okay, so just wanted to share another just kind of announcement around the Medi plans. So DHCS is expanding access to 29 additional counties, and they have shared that this will include San Joaquin and Stanislaus County. And these plans essentially combine Medicare and Medi-Cal benefits into one plan to help provide specialized care coordination and wraparound Medi-Cal services. Their intention is to simplify care with making sure that members are able to use one card, have one care team, and integrated services across Medi-Cal, behavioral health, and long-term services and support. They have open enrollment for those plans, and it will extend through December 7th, with coverage starting January 1st. We have linked to resources that have been shared with DHCS, including the plan list, as well as information sheets about how to join, as well as a fact sheet. So encourage you all to take a closer look at that, but just wanted to share that that's available. And then also wanted to share a regional spotlight. On September 10th, DHCS did share that with the California Health and Human Service agencies, joined by San Joaquin Behavioral Health Services, they did break ground on a Be Well campus in French Camp, California, and they're currently in construction for that. And this campus will include 10 facility types as well as 116 behavioral health treatment beds and 1,205 outpatient slots. So that's really exciting news in terms of expansion for behavioral health services, and I'm sure there'll be more information to come. So at this point, did want to just pause to ask if any of our providers had any updates or spotlights that you all want to share with folks on the call, whether that's any events or resource fairs that you're holding, or just any recent successes that you have experience that you want to share with us. I think it's always great to just highlight the great work that's happening, not only with our collaborative, but also uplifting that to the state as well. So just wanted to pause if anyone would like to share any updates, announcements, or successes. Well, there's quite a lot of folks on the call, so I'm sure someone has something to share.
Hi,
But
Navney. It's Josephine from San Joaquin Health Centers. I was just calling to remind, well, not calling, Jesus Christ. I just wanted to let you guys know that we're having our celebration of wellness this Saturday, the binational event out at SJGH and our health center plan out in French Camp. So I'd encourage your members to come. They'll get free services, mammograms, medical overviews. We'd love to see as much of the community there as possible.
I think Felix, I saw you unmuted. Did you have anything you'd like to share as well?
I do. Thank you. Yes, we're looking for, we're expanding into Stanislaus County. So we're looking for a case manager to work with men and women coming out of the prison and jail facilities. Uh, Case manager for that. I'm also looking for a case manager assistant for our Stockton office and another case manager in Stockton.
Felix, could you share the name of your organization again, and if there are any like relevant information, if you want to drop that in the chat as well, and we can make sure to share that with
I
folks.
I'd love to. Yeah, so I'm with Friends Outside. So we're located in every state prison facility, as well as provide reentry services in both San Joaquin and Stanislaus County.
Awesome, thanks, Felix. Anyone else have any thing that they would like to share? Awesome. And if things do come up, feel free to put that in the chat. So going to move on. I know we have quite a lot more information to get through, so I hope you're patient with us. So did want to share a policy update around Senate Bill 660, which was recently passed and makes updates to the California Data Exchange Framework, also known as the DXF, to strengthen how health and social service data is shared across the state. Just wanted to share a high level of some of the key provisions of this bill, which include authorizing the Department of Healthcare Access and Information, also known as HCI, to now take over the establishment, implementation, and all functions related to the DXF. It will also require HCI to convene a stakeholder advisory group to advise and provide recommendations on the data exchange framework, and adds emergency medical services to the list of required data sharing agreement signatories. It adds additional HCI oversight and enforcement, as well as policy protections regarding not sharing information in relation to abortion, immigration and citizenship status, and more. And also that moving forward, entities that are contracting with DHCS will be required to execute a data sharing agreement. And for folks that may be not as familiar with the data exchange framework and data sharing agreement, we did host a more dedicated office hour a few months back where we kind of broke down this information. And if there is interest, I can make sure to include that slide deck and recording in our post-session material. So just let me know in the chat. If you are a provider that has signed on to the data sharing agreement, just encourage you to keep an eye out for any updates regarding that. And then also wanted to take a little bit of time talking about the current ECM and community supports data monitoring efforts, and talk a little bit about the primary measures that were rolled out earlier this year, which are specific performance indicators set forth by DHCS to assess whether MCPs are meeting key requirements for providing timely and high quality ECM and community support services. So although this is something that the MCPs are monitoring or assessed for, I think it's really important that providers are also aware, and we want to take some time to kind of just go through that since a lot of this is provider driven. So some of the measures include percentage of members that are receiving ECM, the provider network completion, and referral growth, and we'll provide those slides or go through those slides in a sec. But just wanted to share that it's really important for providers to be aware of that, as it's helps support many areas of making sure that we're in compliance and ensuring that members have ongoing access to services and continued ability to contract and receive funding. So this is just a screenshot of the primary measures, and you're welcome to take a greater look at them. And I will also hold space if the MCPs at a later point want to share any additional information. But just at a high level overview for the ECM primary measures, this includes things like the percentage of the number of active providers, for example, for ECM in each population of focus for each county, and that will be defined as having a provider with at least one ECM encounter in that county on a quarterly basis. So MCPs will be assessed on that, as well as the 12-month growth in the percent of members receiving ECM. And there will be additional primary measures in regards to ECM that are going to be rolled out next year as well, which include the provider type diversity, as well as the percentage of MCP members that have received ECM in that quarter. And then these are the primary measures for community supports in terms of the growth in the number of community supports referrals in a 12-month period based on the action plan, as well as similar to ECM, the number of active community supports providers per each county in each quarter, as well as making sure that there is information publicly available for providers and members with updated and relevant data. And just wanted to pause if, I don't know if any of the MCP partners wanted to add on any additional information regarding the primary measures, but if not, we can keep going. And I know we're sharing a lot of content in today's session, so like Melissa said earlier, encourage you all to just take a moment to sit with this and let us know if you have any questions. Also, a little bit of a shift, but I think kind of continuing on to our conversation, I think, you know, as we work together, I know we continue to hear from providers around various different challenges of potentially receiving referrals or going through the billing or claims process. So just wanted to use this as an opportunity to kind of do a bit of a temperature check, but also get feedback from you all on what types of challenges you might currently be experiencing, whether with receiving referrals or submitting claims. I think this will be helpful for us in terms of future sessions, knowing what support we need to provide, as well as for our MCP partners, because I know this is something that providers continue to encounter. So just wanted to hold space for that. You can share this via in the chat, or if you would like, I think we can enable the poll as well. Thanks, Melissa. Yeah, so if there are challenges or things that you think would be helpful for us to cover, please definitely let us know. We want to make sure we continue to provide support where it's needed.
Is it okay to ask about specific billing challenges that we've had in this forum? Is that okay?
Sure.
So with our health plan claims, we were told that there was like a system upgrade, the QNXT 2.0, but we've had a bunch of stuff denied and just really having challenges getting to the bottom of it. And we don't think it's based on the upgrade, but anyways, we're having some challenges and wondering
Mhm.
how to get to the bottom of that.
Hi, Carrie. This is Niyati from Health Plan San Joaquin. Thank you for bringing it up. I know we're in a very large forum here, so my recommendation: feel free. To feel free to contact your provider services rep, share some
Yeah,
examples.
we've done that, and we keep getting like, "Hi, we don't have any additional information. We're having issues with the system
Can you
upgrade. I'll let you know
forward me
once we."
that
Yeah.
inquiry,
Okay.
please? And then
Sure.
I will absolutely get that figured out for you
Okay. Thanks so much.
some way.
Yeah. Thank you.
Appreciate that. And I know folks are filling in the poll as well. So we can just leave that open for a little bit and I'll continue on. Okay. Okay, so this is the now we're gonna move on to just doing some high level report out on the quarterly implementation report that DHCS recently shared earlier this month. And this data does cover the first quarter of this year. So just some high level highlights from Q1 that we wanted to share, and we're also going to kind of share some slides with more detailed information, but wanted to highlight that based on the data, ECM enrollment did increase by 61% compared to Q1 in 2024, which is really great to see, with 177 plus members served. ECM enrollment for children and youth has more than doubled. For community supports, they have reached more than 400,000 members with more than 1.1 million services delivered. And nearly 94% of Medi-Cal members have access to at least 10 community supports, with the most used services including medically tailored meals and housing-related supports. So we won't spend time going through all of this data on this call, since I think it will be pretty lengthy, but I encourage you to look at the slide deck. But just to orient folks, we went through the report and just kind of pulled out the data for San Joaquin and Stanislaus. So at the top, you'll see the total number of enrollees, and then for the ECM slides, broken down data for San Joaquin and Stanislaus, and includes enrollment numbers for each of the populations of focus per health plan. So this is for adults, and then for Stanislaus, adults, as well as sharing the enrollment numbers for children and youth for both counties, and then also community supports utilization. And I think I saw a hand go up. I'm not sure.
It was me, Nanvi, but I saw the footnote around the asterisk and the data being suppressed.
Okay, thank you. Yeah, so encourage you all to take a look at that. We won't go into too much detail, but wanted to provide this as a resource for you all because I know there's a lot in the quarterly implementation report. Okay, so that was a lot of talking from me, and now you'll get to hear from the MCPs. So at this point, we'll transition to the MCP updates, and I believe I'll be passing it to Niyati to do any updates for Health Plan of San Joaquin.
All right, lost my mute button. Hi, everybody. Good afternoon. My name is Niyati Reddy, Director of Special Projects Operations here at Health Plan San Joaquin, serving San Joaquin Stanislaus and, of course, Mountain Valley Health Plan. We support El Dorado and Alpine. Again, thank you very much for joining on these regularly. These CPI meetings have been wonderful. It gets us all together, and a lot of things are happening, obviously, in the DHCS world. What our focus is on transitional rent, and I appreciate Health Begins, providing, folks the opportunity and the overview of transitional rent. Remember, many of these members or the cohort of members are going to be very, very minimal. So we are really actually having a very small network at this time, specifically focusing on our relationship with the county. Stanislaus County is the only one that we're going to have a very small set of providers. Turning Point and Tracy Community Connections are going to be the transitional rent providers in the county for Health Plan of San Joaquin. So we're all in the midst of preparing for that implementation, which is going to go live 1/1/26. There is a TA, Technical Assistance Flex Pool Academy coming up for many of these counties. They're going to be joining DHCS and their Transitional Rent Academy gurus of some sort early November to discuss how to implement transitional rent from a flex pool perspective. So we'll probably share more after we hear back on how that academy goes. And then as we get closer to go live, we'll definitely provide folks an update. Again, the focus is going to be on behavioral health population of focus. There's many other populations of focus under transitional rent, but our focus for Health Plan San Joaquin is behavioral health. I also wanted to kind of just provide a little quick update. We're still working on ECM, Justice Involved program implementations as well. As you know, San Joaquin County Sheriff has already gone live as of January 2025. Their probation, the county's probation department, is going to be going live later in 2026. Around the corner is going to be Stanislaus County. They're planning to go live as of now for both probation and sheriff July 2026 with the possibility of extending it to September. So more information there. And feel free to contact me if you have any questions about any programs, any new implementations. And again, going back to primary measures, I really, really want to encourage providers to continue working amongst the community, being able to advertise your services, make connections, because it's all based on referrals. We really would love to see utilization increase. And again, that's through partnerships. So appreciate your partnership and thank you for this opportunity. Thank you.
Awesome. Thank you, Niyati. If there aren't any questions, I'll pass it to Ileana from HealthNet.
Well, I love going after Nayeti because she usually presents some really great prepared updates for our teams. And when I say that is because our MCPs here in both counties work really closely, and there's a lot of opportunities for us to leverage each other. So I think she provided the updates around TR. We are also here at HealthNet going to move forward with a small population of our network. As noted, there's going to be a small number of members that are going to be identified who are eligible in this first cohort for transitional rent. So we're going to start also with 2 providers. I think I mentioned earlier that we don't have any contracts in place yet, but we're really close to executing those 2 contracts, hopefully by the end of this month. Once we have that, we can provide that update to this team. And again, we're going to be onboarding those providers as well as the county and providing an update to this forum as we get closer to go live around the workflow and how does that look like for each county. I will also, as noted by Nayeli, will be attending the Flexible Academy kickoff, which is in November, which will allow not only the county departments, but also the managed care plans an opportunity to continue to learn on how to implement the Flexible, at least in Stanislaus County. For JI, the updates were provided, and for that particular go live, we're working really closely with the correctional facilities on those opportunities to implement those services. We've received some referrals from San Joaquin already from the adult department, and so we're processing those. I think as it relates to other updates, utilization and referrals, thank you for providing that update to Health Begins around the utilization in the last 12 months. We're continuing to see a growth, but we're still not seeing a growth. I think as we expect, right? Because we know that the need is there. So I want to continue to engage our providers and continue to offer the opportunity to our providers to reach out to HealthNet directly, either to myself or to the other teams that you work with. And if they're not responding, make sure to loop me in. I just want to be a part of the conversation, make sure that we're meeting the needs of our providers, that members are accessing those services. If there's additional tools that you find that you need in order to provide information to the members, please feel free to share those with us. We'd like to incorporate feedback from the providers to ensure that we are hearing, from the local need and from the experts in the community. So again, feel free to reach out. In regards to updates, a lot of the updates will come to our providers through our newsletter. But if you're not getting those updates on a monthly basis, please feel free to reach out to me and we can get you on that distribution list. If nothing else, feel free to reach out with any questions, or if you just want to grab coffee and kind of talk through some of the work that we're doing here at HealthNet, happy to do that as well.
So thanks, Ileana. And now I'll pass it to Kat from Kaiser Permanente.
Everyone, I really don't have enough any information on the TR, the transitional rent, or the flex pool to share. I'm gonna switch gear a little bit. I'm gonna talk about our open enrollment for the Kaiser Community Health Coverage Program that is starting November 1st. Next slide, please. This program is actually for people that do not qualify for any other insurance. This program is free, and eligibility is open for Californians, actually. So if you can take the time to review the to review the coverage, it actually has like the Platinum 90 HMO plan. Next slide, please. This is what the benefit looks like. You have a primary care health plan, which is going to be Kaiser. You become a Kaiser member if you're eligible. And then you have specialty care as well as pharmacy and labs. Everything is going to be, you do not have any out-of-pocket expenses. So this is going to be all on Kaiser. The insurance is going to be all on Kaiser. So if you, I have actually added the link to the chat so that if you can share this information, family, friends, colleagues, at work, so so that they are able to apply for this coverage. Next slide, please. So on the next slide, you see it tells you who is eligible. Like I said earlier, if you reside in the Kaiser service area, you're eligible to apply for the insurance, and individuals over 21 are eligible to receive the CHCP subsidiary for a maximum of 3 years. And then if your income level is between these 139% to 300, federal poverty level, you qualify as well. And then it doesn't require any legal status. If either you're a citizen or not, you still have the right to apply to the insurance coverage. Next slide, please. And then I have actually provided a link again for you to apply. So take the time to take a look at it. You can either send in the application through Kaiser website, or you can call the 800 number on the there's an 800 number online that you could use to actually call to have someone help you with the application. I believe, next slide, please. So this is just, so how you can help, this is just saying, you can actually share this information in the community, share with staff, your network, and then participate in the enrollment and training. For any questions pertaining to this, you can send me an email. My information is on this slide. Next slide, please. So my email information is here. My contact information is here. So you can reach out to me if you need additional information. I believe that's the last slide. Thank you all so very much.
Great, thank you, Kat. So with that, we're gonna move on to our last section of today, which is our next steps and closing. So we'll share some brief announcements as well as information on our upcoming office hours. So did want to share, I know we've shared about this via email, but just one last reminder around the CPI Best Practices webinar. It is occurring this Friday at 10 a.m. And it will be around strengthening connections with children and youth providers. And in the webinar, they will be covering how first 5 programs across California have been working with ECM and community supports providers. They'll share more information about how schools and school districts can help connect children and families to local organizations, youth programs, as well as health plans. So if this is of interest, encourage you to apply or register to attend the webinar, as well as share it with anyone that you think would benefit from attending. And then I know Josephine did a great job of covering this earlier in the announcements, but just wanted to share around the celebration of Wellness Health Fair. I know we had sent out information about this event, and for folks that wanted to register to be a vendor, I believe the deadline for that has passed, but if you're interested in attending or want to share this with community members, do encourage you to let them know. And then lastly, wanted to share more information about office hours, which are happening this Thursday at 11 a.m. Please note that this is a joint office hour that we're hosting with the Northeast Collaborative. And you'll notice that the registration link for this office hour does direct you to the Northeast office hours registration link, since we're using their link. So we have gone ahead and deleted the link for San Joaquin Stanislaus, so just wanted to make sure to let folks know. And this office hour, we're specifically going to be covering marketing and referral best practices. So we're going to be reviewing 2 key resources that were recently put out based on some of the work that CPI facilitators did across the state. And we'll be reviewing 2 toolkits, which include the Referral Best Practices Toolkit, as well as the Provider Network and Awareness Best Practices Toolkit. We'll take some time to also share examples of how others are applying these tools. If you have questions about these toolkits, this would be a great opportunity to ask them. I know we had shared the toolkits during our last session, so we'll also gather some feedback as well as discuss opportunities to integrate these resources. So encourage you all to attend those office hours on Thursday. And I think with that, we are at our last slide and want to thank everyone for attending today. Thank you, Melissa, for dropping all the links in the chat. Hope you all have a great rest of your week. And with that, we'll close out. Thank you, everyone. Bye.
Thank you. Take care.